Welcome to your internal medicine clerkship. Now this clerkship comes with 3 guarantees. You're going to be a good reporter. You're going to interview and do physical exams on real patients, review the data, and present all that information orally and in writing so that you sound like a real physician. It's going to help you on your other clerkships and down the road whatever specialty you go into. We're going to push you to be an interpreter, come up with assessments, differential diagnoses, and if you're good and you really demonstrate ownership, we'll let you manage and educate our patients with us. The next thing is licensing exams. You should be more confident when you take this exam because we give you context for the science and we deliberately review it during the 15 weeks. And not to be underestimated, you're going to be happy. Tired a lot of days, but happy because you've directly contributed to the care of patients, you've learned something, and you've improved with feedback. Now the rotation is 8 weeks long, could be 4 weeks of clinic, then 4 weeks of wards, or wards first, or 8 weeks of wards, depending on what's best at your site. During the week, there's a lot of protected educational time. Twice a week, you have a preceptor session where you and a couple other students with a specially selected faculty get together to practice your presentations, evaluate patients at the bedside, review cases, and educate each other. Another big thing is the write-up, and it's always due the end of the week on Sunday. Remember to upload every assignment you do into Sakai and email it to your preceptor so you can get feedback. Now what does ambulatory rotation look like? Well, first you're going to be working one-on-one with a physician, and everyone's schedule is a little different, but as an example, let's say it's going to be the same cardiologist every Monday morning, endocrinology clinic Wednesday afternoon, and then gastroenterology or GI Thursday mornings. Each of 3 half-days per week you're going to be working with a different general internist, and that gives you 2 half-days that are unscheduled to review patient records, catch up on your notes, documentation, or other assignments. For each half-day of clinic we want you to see about 2 patients, which means you'll have about 2 hours of homework for each half-day of clinic because you have to review patient charts in advance, write your clinic encounter note, follow up your patients after clinic, and then read a review article or other brief assignment from each physician. On the inpatient wards, you're going to work on a team with 1 or more other students, interns, a resident who supervises you, and an attending physician who's responsible for the overall care of the patients. You'll get in early to round on your patients 6 days a week, attend a case conference, and then use the rest of the time to participate in procedures, interact with consultants, and do your chart documentation. You should have 1 to 3 patients at any one time, and you'll get new patients whenever your team is on call, once or twice per week. Most of your grade, as it should be, is based on your clinical performance, and it's those reporter, interpreter, manager behaviors. You're not compared to anybody else, you're not graded on a curve, and it's not subjective. And we have specially trained faculty to collect this feedback in person and then give it to you. Week 8, you're going to take the NBME shelf exam. 59 score or above to pass, 5th national percentile, no minimum score for honors. This is a lot of information. We'll go over it again at orientation. Don't worry about it. And don't lose track of the big picture. You've worked hard over the past 18 months and you've earned the right to be here. But you can't be a bystander on the internal medicine clerkship. You're expected to give your opinions. You're going to be directly caring for patients, seeing a lot, doing a lot, all under the supervision of physicians who are carefully selected and keenly interested in you doing well. We'll see you soon.